The first one is Stephen Feather. Steve's going to talk about his journey with his son and high-risk and medically complex care. And then Tracy's back again for her 14th topic today. And then Babitha, who spoke yesterday, is back again. So that's great. And then Dr. Michael Schechter is going to talk about lungs in some degree, right? And Dr. Gupta, who's going to talk about sleep. So we've got some very, very interesting topics ahead for the remaining of the morning. Tracy, you're not? Okay. Okay. Stephen, I think you're up.
Thank you, Fred. Good morning. All right, I'm going to see if we can't get back on track. No, that's not happening. Good morning. My name's Steve Feather, and I am the father, legal guardian, and primary caregiver for my son, a soon-to-be 27-year-old with LGS. Before I start, I want to ask a couple questions. How many of you are caregivers for somebody with 3 specialists? Okay, keep your hands up. And look around and look at the group, guys. How many of you have 5 specialists? How many of you have 7 or more? Okay. Your kid's complex. That's what we're going to talk about a little bit today, and then Tracy's going to follow up with more details. So over the next few minutes, I want to discuss high-risk and medically complex care. LGS is what has brought us all together this week. LGS starts or represents one system, and I don't want to minimize LGS, but it often travels with so many other things, as all of you know. But it starts with the nervous system. But when we look at everything else it pulls in, there's so much more. When we look at my son as an example, we can see, one, a trach, which affects the respiratory system. He's got a GJ tube, that's our digestive system. He's got a central line because of the other issues, and that's tied into his circulatory system. He's in a wheelchair right now. When he is walking, he walks with AFOs. That's our musculoskeletal system. And what we can't see from the outside is a weakened immune system, endocrine issues that we've got to test for regularly, and a compromised immune system. The label for him is medically complex. That sounds really scary. It just means that he's got 2 or more underlying issues that affect different body systems. That's all it means. But with that comes some responsibility for the caregivers and for the clinicians who take care of them. In his case, we have to look at pneumonia, falls, malnutrition, dehydration. All of those are high risk. So now he is medically complex, high risk. What does that mean for us as caregivers? Complex cases require frequent visits across multiple domains. That means neurology, primary care, pulmonology, endocrinology. Complex cases require better collaboration between our specialists. Those conditions don't operate in a vacuum. They affect each other. Complex cases require excellence in timing. We're going to run into, and you're going to already experience this in most cases, your visits are more frequent. Instead of going a yearly physical, like I do, Caleb goes every 3 months. Or if we're in a bad spell, every 2 weeks. It is adjustable, right? Have you guys experienced that? The highs and lows of the full calendar. So how do 2 people like Lisa and I keep all of this straight? It's hard to do. Record keeping has become the most important tool for managing care for a medically complex loved one. We used share calendars, shared reminders, shared notes, and shared folders. This allows either of us have access to his schedule, EOBs for our insurance company in the shared folders, notes so that if I go to a doctor's appointment, she can put a note in to remind me to say, hey, I have a question for that doctor. And the reverse is also true. We can also read those notes post-visit so that if by chance the clinician calls her during work hours or vice versa, we have access to the information the other one had already talked to the doctor about. That's continuity. I use that word because it's important. Last year I was asked to speak in Philadelphia, and I talked about continuity of care, and I hammered on clinicians and the medical industrial complex that there is this lack of continuity between pediatrics and adults. Well, there can be a lack of continuity in our own household at times. You don't have to have a system like ours. Ours is complex because I'm a computer geek and she's good at tolerating me. The simplest version of it is already in your conference bags. You got a notebook, you got a pen. Turn that sucker sideways in landscape view, draw a couple lines down. First one, column, dates. Second column, what happened? Third column, what did we do about it? Start there. And I encourage you to do that because that information is what your clinicians need when they're treating. It's what researchers need when you're involved in a study. It's what anybody you hand your kid off to needs. They need to know what you know, when you knew it, and what it affects. Doctors rotate, nurses change shifts, charts get split across hospital systems. You are the only person who has been through all of it. You are the continuity. You are the keeper of the record. You can start today with that notebook. Thank you.